Hello, it's Wednesday again already. I'm Bev Hosford and this is Erin Nishke, and we are here on the NFPT Facebook page. Kind of fun. I never realized I could hang out on a Facebook page. Up in the club. So here we are, NFPT Live. It's Wednesday, and we're going to talk all about the Boston Heart Test because it is the month of love, the month of the heart, and we figured rather than go over all the same old heart information, we're going to dive into this really awesome diagnostic test, something that I did this year, and something that I really would encourage anybody to look at, especially if you're questioning what you're doing. You know, like I feel like a lot of times we're just following these rules, like eat this much fiber, eat this much don't eat this much saturated fat, don't eat that, exercise this much. And it's like you're following all these rules, and then what if you're not getting the results that you're looking for? Or, you know, how do you really know what your health is like? And I've just really loved taking this test, and then I had some red alarms on it, so I'm following up every 3 months this year, and then my doctor said after that we'll follow up maybe like once a year, but just kind of trying to tweak some things. So we're going to tell you all about this test and talk about some healthy heart factors today. So if you're here, I see people signing on. Say hello. Looks like Billy's here at headquarters, and John just checking in. Sweet. How are you, my friend, Erin?
Doing pretty good. We've been fighting some crud in our house. It's been like typhoid central. So don't come to our house, whatever you do. But other than that, pretty good. How about you?
I'm pretty good. Yeah, my husband was away this weekend on a ski trip that I could have gone on with the baby, but I decided to stay home. I was like, why don't you go? We'll stay home. I'll be super mom. Yeah, so I stayed home with the baby, and it was a lot of work, but it was, when he got back, it's like, I feel like an octopus now. I've got like extra arms, you know?
Right.
Oh, someone else can change a diaper, and someone else can, and so it's been really nice. And of course, I love having my husband around too.
Well, there is that benefit too.
Speaking of the month of love, but man, there's nothing like a challenge to then make everyday life seem easy again, where you're like, you know, so I feel like challenges are good in that way. So
yeah, I think we need those to keep us humble and to help us recognize we don't have to do everything on our own. And if you can't do everything on your own, that's okay.
Yeah.
That's okay.
Well, and it gave me time to, I worked on I'm submitting to TEDx, the TEDx Bozeman, which is a smaller version of TED Talks here in town. So not having Carl around, it kind of gave me that extra, like normally I'd be blabbing my head off with him all weekend. Instead, I just blabbed to myself, practicing the script over and over again until I got it to where I wanted it. So it was great. Sweet. Well, I see we've got some people on. Say hello to us. If you have any questions about heart health, you know, or experiences, ask us. I'm wondering if anyone else has ever taken the Boston Heart Test. If you have, you would have gotten one of these brochures. Some of the basics about it, it tests 86 different, I think 85 or 86 different measures. Mm-hmm. And I think each test is $1. So, and you don't have to do them all. So you could do $85 worth of testing, and then they recommend you redo it a few times during the year, depending on what your results are. So it could be like a few $100 investment along with, you know, doctor fees. But I feel like if I'm going to spend all this time and money and effort on my health, like eating a certain way and whatnot, I'd like to at least know that I'm investing properly. So anyway, it's one blood draw, and then the first blood draw, they test everything. And then after that, I did another blood draw 3 months later, and they only tested like 20 items because they didn't need to retest the things that looked good. So, and they cover 4 main categories. So let's go through the 4 main categories. And we've got some really interesting things to tell you about with heart health today. The first part they cover is lipids, which is what we know as cholesterol. And what I found really interesting is, you know, I always knew that we had different sizes of cholesterol, but you have 1, 2, 3, 4, 5 sizes of HDL cholesterol. And So like for me, I have lots of good HDL, but I'm a little low on the bigger HDLs, which my naturopathic doctor, who's the person who introduced me to this, Dr. Bronwyn Bacon of Elevate Health here in Bozeman, she said that those big cholesterols are like these big buses, you know, and they go around and clean up. And like you want a lot of those because they are like the cleanup bus. And then the little ones are good to have too, but it's so interesting. So like when you normally get an HDL test, it'll give you a number and maybe it's healthy, but unless you break it down here, you know, you're not really, you may or may not have as much efficiency with your HDL as you want.
Yeah, that was one thing that was really interesting to me as well, because I do like a wellness blood draw every year. My husband and I both do. And it's a great baseline test. It can certainly tell you, it can help identify maybe budding issues or things that might become an issue for you later on. And it's more or less preventative, really. But yeah, like you said, it's compared to this table of norms of LDL, HDL, your total cholesterol, your, you know, creatinine levels, all of that stuff. But it doesn't break out in real specifics. So it's not super individualized, and there's no genetic factor with that either. So what's good for one person might not be good for another. And I think we're starting to see more and more of that in research and in certain diagnostic tests that are coming out. But yeah, it's great if you have an HDL that's, you know, above that 40 milligrams per deciliter of blood level. That's awesome. That's great. We don't want it below that, but then break it down even further and find out what are those sizes. If you've got that many different sizes, which one does your body tend to have the most of, and how then does that affect your total cholesterol ratio and in turn, like the full functionality of your heart?
Yeah, because the HDLs are what helps manage the LDLs, which all the bad cholesterol, but we know how much we love that word bad.
Bad.
And then this test also looks at how much cholesterol your liver is producing. So 75% of your cholesterol actually is produced by your liver, and then the other 25% comes from food. So this gets all into the nitty gritty about liver cholesterol. And interestingly enough, my liver is an overproducer. So even though I eat healthy and exercise and follow all the rules, I have to just be careful. And I've always, since I was a kid or teenager, I've always had my cholesterol has always been borderline. So it's interesting. And that's kind of what we wanted to talk about today, you know, is like a lot of research on how exercise can help your cholesterol and help your blood pressure. And it can, but sometimes there are people out there that are the exception. So it can be helpful to know and just be careful when you're telling people that these are definite outcomes. And there's no doubt my cholesterol would probably be really bad if I didn't exercise, but
for sure. Yeah. You'd probably be over 32 on the cardiovascular risk profile, Beth.
But I'm coming clean with you guys. My cholesterol is borderline, even though I'm probably, you know, I'm not perfect. I don't exercise perfectly, you know, but I eat pretty well. So anyway, that was the first part of the test. The second part of the test is inflammation. So inflammation in this test, which I think is interesting, that's all about like the walls of your arteries, like are they inflamed or not? And I think sugar was actually part of the test, which is interesting.
Because if the body's under stress, cortisol is going to be released, and that then helps to gluconeogenesis, which is adding those sugars to your bloodstream so the body can basically fight or flight.
Sure.
So connection there. And inflammation, you know, I think it's so interesting, and it's something that's I think overlooked quite often and or misunderstood, you know, and it's blamed for a lot of things like cortisol being a bad guy. And, you know, it's not really true. What inflammation is an indicator of dysbiosis or something that's not balanced or healthy that's going on in your body. It's responding to some sort of physical and or mental stress. And so the body responds. That's its natural defense mechanism. And we experience inflammation probably daily. You know, think about if you stub your toe or you get a cut or you're bitten by a mosquito, your inflammatory response is going to be activated automatically. It's not something you can control. The same type of response will happen if you're chronically under stress. So then that means there's chronic inflammation, which does have a major impact on your health. And it's something that I think we don't pay enough attention to. And I'm not saying that just in the fitness industry. I think it's, widely spread because we look at inflammation as something to blame versus a signal that it's trying to tell us. And so I think the one thing that's important about that inflammatory test is to, one, identify that there's inflammation going on somewhere in the body. The downside is we can test for that, but it's not going to say, oh, it's here or it's there or it's because of this. That's when you need to have that larger conversation about what's the cause of this inflammation. Inflammation is a result. It's a response. It's like an SOS signal of sorts.
Yes. Awesome. Yeah, that's interesting. I didn't even think about that connection between like stress and cortisol and that sugar release. Because here, let's see, some of the markers were LPPLA2 activity. I'm sure we could do a whole show on that, but that's, and then there's fibrinogen,
yeah. And there's C-reactive protein, and there's plasma viscosity. There's all sorts of these measures, and that's what they are, just measures. They're not identifiers of, oh, your liver's inflamed. Oh, this is inflamed. Here's a drug you can take. It unfortunately does not work that way.
Right. Yeah. But then they do go into the blood sugar, HbA1c, and insulin resistance, glucose, adiponectin, a hormone that's produced by fat cells, insulin, which we all hear about, and C-peptide. So I feel like in recent years, we've really come around to learn that like eggs, it was always like eggs make your cholesterol go higher. And maybe for one person they do and someone else they don't. And we've really come around to realize that sugar is breaking down those arterial walls, and then the cholesterol is getting into the bloodstream. So it's interesting to think about that factor, about the sugar factor. And that's one thing I love about this test is not only does it tell you if your like sugar's high or cholesterol's high, but also tests like what's happening in your body with food. Like, yeah. So your sugar could be high because of sugar, or it could be high because of stress, as you're saying. And so later in the test, they look at like how much saturated fat is Bev eating, how much monosaturated fat is Bev eating, how much trans fat, how much, and they look at all of those factors. And people always criticize me because I like to eat bacon. But according to this test, my saturated fat levels, or the amount of saturated fat I eat, is totally fine. Like, it's not showing up in my bloodstream in my test as and I don't know if I totally understand this right, but that was, my naturopath said, like, you don't need to, decreasing your saturated fat intake is not really going to help you at this point. Like, you could go on a saturated fat-free diet, but it's not necessarily going to help you. So, which, we could play around with that and test it, but yeah, I'm going to keep eating my bacon.
Yeah, you roll on with your bacon, Bev. That's fine. Yeah, and I think that's where we can get in trouble when we're trying to guide clients and or interpret for ourselves, that trying to box ourselves into, oh, well, these are the current recommendations and guidelines, and they're solid guidelines. Like, pay attention to the dietary guidelines that come out, that not to diminish the importance of that, because they're very well-rounded guidelines. They make so much sense, and they're always based on current and emerging bodies of literature. So it's like, if you think back to the recommendations in, I don't know, 70s, 80s, I don't know, some long time ago, where low fat was the thing to do. And that kind of thought process is now changed because of research that has led to a greater understanding of how the body processes and then stores nutrients and how it's used for energy. Sure. So the biggest takeaway with all of these types of diagnostic tests is that it's individualized and it needs to be considered in that way. It's just like for you, like genetically, you've got some sort of genetic link that promotes greater cholesterol production for you. You need to watch your exogenous sources. So we can't box people in. And I think that's what we tend to do because it's easy. We've you've got these guidelines. I want you between here and here. But this test, this type of test and other diagnostics can certainly, I think, help professionals think a little bit wider in terms of maybe what might be going on with their client.
Absolutely. Yeah, and that you just touched on the third part. So the first part is lipids. The second part is inflammation. The third part of this test is genetics. And this test looks at the statin-induced myopathy gene, the APOE gene, which is actually the Alzheimer's gene, and the blood clot protein genes, factors 2 and 5, and folate metabolizing gene, which is MTHFR, which is a big one that's been coming up a lot in the vaccination industry, which, like, if you have that gene, you may not be able to detox as well. But anyway, this test looks at all 4 of those genes, and if you have the APOE gene, which puts you at risk for 40% risk for Alzheimer's, then naturally you absorb cholesterol, you absorb more cholesterol and you have a harder time removing it. So that's, again, where, like, even if you're doing everything right, this gene can really make it tricky. And then the other interesting thing, one of the genetic tests, the blood clot protein genes, it looks at it tells you that if you should or shouldn't have oral estrogen therapy or oral contraceptives, because if you're taking those, it can make your cholesterol higher than it needs to be as well. So or smoking, if you're smoking. So that's where, like, some people can smoke their whole life maybe and never have a problem. And other not that you should, but and then if someone doesn't have enough of the folate metabolizing gene, there's an increased risk for clots as well. And so I just feel like, what are we doing here if we're not looking at the genetics, like you said?
Right. And I think we'll start to see more and more of that genetic research coming out. I mean, there's a ton of it available. I took a genetic test that specifically looked at the nutritional factors. And so it gave me information on, like, this is, what genetic indicator you have, and this is what that means. And it was a simple saliva test. It is pricey. But nonetheless, going back to thinking about, we're doing all these things to invest in our health, or at least we think we're investing. But what if we're just not putting those deposits where we need to put them based on how our own individual bodies will respond? So I think there's more and more respect for genetics. No, we can't control them. We can't change them, but we can work to understand them and work within that kind of genetic blueprint that we've all been given, and try to work with the essentially, not to be too cliche, but sort of, is work with the cards you've been dealt.
Yeah.
Work that you have, and the more understanding you have about that, the greater impact you can have on your health, your client's health, and I think the industry as a whole, if we elevate our knowledge to that level.
Yeah, I agree. I just think, you could be like trying to eat lots of fish to, get your omega-3s up. You could be trying to do all these different things or adding foods into your diet. And how do you really know if you need to be doing that or not? Like, you could spend $1 on that test every few months to find out, and then not need to spend $100 on fish every month or whatever. So,
right.
So then the last part of the test, so there's genetics, and then the last part is all about metabolic. So they look at your liver, kidney tests, muscle tests. So they look at creatine kinase and NT-proBNP and uric acid. And then they look at thyroids, homocysteine, TSH, free T4. And if all these, like, words and acronyms are, like, going right over your head, I am with you. Like, I recognize some of them. I don't know what some of them are.
Right.
That's why you only take this test with a doctor or a naturopath. And I like doing it with a naturopath because naturopaths have a lot of remedies they can use with you to try to work with some of these numbers. And that's what I've been doing, is we're trying to work around some of these numbers, because she said your cholesterol is borderline. It's healthy enough right now, but it's probably going to become an issue when you get older. So let's figure out what your body likes to get that number down and up, respectively, and we'll just figure that out now. And then when you get older, we won't have to worry about that stuff. We can just, do whatever it takes. So we've tried some things, like we're trying a niacin run right now. We just started that because the first round, she just wanted to try fish oil with me. She's like, let's just try fish oil. Sometimes that's all it takes. And then it didn't affect my cholesterol a ton. So now we're trying niacin, and then I don't know what we'll do after that. But she's just going to try some different things with me to see what can happen. And I think that that's great, because when we talk about prevention and longevity, like, why not figure it out now? And then in the midst of doing these tests, we found out that my iron and ferrate levels were really low. She did those tests in addition. It was in addition to this one, but I feel like getting on an iron supplement was life-changing for me. It just
energy-wise.
Yeah, energy, and then with my cycles. And I always used to crave red meat every day, and I would eat as much of it as I wanted because I was craving it. But I think it's better for me to just get that iron. You know, I don't eat a lot of like fortified foods, so maybe I don't get a lot of iron because of that. But it's and I've been taking, and you know, after you give birth, your iron is going to be low for a while, and so we've got my ferrate up, which is the stores, and then now we'll bring my iron up. And she's like, you probably won't have to keep taking iron supplements. It's just probably and some aftermath from birth, and then we'll see where you're at. So metabolic tests, I love that. You know, we don't normally think about that as part of heart health, but
right. No, we don't. But I mean, you know, the heart's really kind of it's the most important organ. You know, I don't know that research has come out and said that, but I'm saying it because if it's not beating, what's it matter? You know, like it's going to affect blood flow to muscle, then to the brain, and just your overall functional capacity. And that's something that I think we don't realize how many variables inside the body affect heart health. You know, just like, why would the liver be an issue? The liver's not located next to the heart, you know, that kind of thing. It's like, sometimes I think people can interpret it as, well, the proximity of organs. Well, obviously that's not going to affect this, but the human body is a system in and of itself. And so when one system is off, all systems are off.
Yeah.
So, you know, there's this great symbiosis that goes on in the body, but then, wow, it can turn south and unravel real quick. And not saying that you have to get this test or you have to tell your clients to get this test because it's going to change your life and it's going to change theirs, but it is more information. And I did on the site too that I believe they work with insurance as well, so that's always something to research and encourage.
Oh yeah.
So
most of the time, insurance will cover the entire test.
Yeah. So definitely don't think this is 100% out of pocket for sure. There is that benefit to it. And so I think we'll start to see those diagnostics getting better and better over time. Yeah. And again, think about it as a collection of information. How can you put these pieces together and maybe work to figure out, okay, what's going on here? Why is this person experiencing this if I look at all these? And not that fitness professionals that's not our scope of practice. Again, we can't diagnose, and we really should not interpret those tests either. I think when it comes to things like your good cholesterol and bad cholesterol, like, you can certainly say that's what these numbers are and that's what they're related to. But for the interpretation of it, you need to have that exact conversation with that licensed physician for sure. So don't be dancing outside that border. Don't do that. That can be scary.
Yeah. You know, it might even just be a good place for a trainer to start by just taking this test themselves. I feel like for me, it was more educational than all of my classes on systems physiology in college. Like, going through this test and sitting with the naturopath and looking, you know, especially if a number is outside of its norm, you're more likely to pay attention to what that is and to learn about it. So, you know, perhaps it could just be a goal for a personal trainer or fitness instructor to just take this test themselves and just, you know, lead the way, like, on their own. And I just totally forgot we've got our audience here. I'm going to see, I didn't forget about you guys, but Myra is here. Good morning. Billy says, always give 100% unless you're donating blood.
Solid advice. Yes.
Snowing in upstate New York, says John. Just finished cleaning up from the last storm on Monday. And Billy says, I'm blurry. Well, that's all right.
You're not. And, oh well.
I don't know what to do about that because that was a little while ago, like 10 minutes ago.
You're clear to me right now, but then sometimes like my mom will text me like, hey, you're blurry. And I'm like, I can only see this much of myself.
Yeah.
So
and it's like, I don't know what to do with I guess I could always, let me turn myself off. Sweet. Yeah. And so then the last, can you hear me?
Yeah, now I can, but you were gone for a while.
Can you hear me now?
Yes.
So the last part of the test I already touched on, which was they look at your saturated fat, trans fat, the unsaturated, omega-3s, EPA, DHA, and ALA. So my fish oils were down. So she was like, you don't want to overeat fish because the mercury in it. So, and she's like, you'd have to eat a lot of fish. So I'm taking a supplement for that, which you want to be careful which type of fish oil supplement you take. Again, there's all these, like you're just going to go to Costco or Walmart and pick up a fish oil. How do you know if that fish oil is actually doing anything? So I think it's important, if you're going to invest in a fish oil, even like just go get the fish oil test done. $1, find out if that fish oil is actually doing anything for you. Because otherwise, you can spend like half as much money on a fish oil that's not doing anything, or spend a little more money on a fish oil that actually does something. So I think we've got to be careful there with those fish oil supplements, because I've even heard, some of them are rancid, some of them are like, we just don't know what's in them. And as Erin always says, supplements are unregulated. So
highly unregulated.
It's like, whenever I'm taking my supplements, I hear you in the back of my head. It's like, these are unregulated. Oh, where did Erin go? Funny. Well, she'll be back. So that's the Boston Heart test. If you guys have any questions or anything that you want to share about heart health, go ahead and pop that in the comments.
I don't know why I disappeared. All of a sudden, I'm like, oh.
I'm kind of curious if you're still here with us, or if you're here with us, which of the 4 markers are you most interested in? Number 1, the lipids. Number 2, the inflammation. Number 3, the metabolics. And number 4, the genetics. Like which area? So like say you were only going to take part of this test, which you can do. There's like this form you fill out, or the doctor fills it out, and you can just check off the ones you want to take. You don't have to do them all. So if you were just going to take one part, like, which one would you want to take? And, are you interested in learning about your genetics? That can be kind of scary to learn about, because genetics can be expressed in different ways, but genetics are genetics. So,
right. And I think about it in terms of it's information, it's knowledge, and knowledge is power.
Yeah. Yeah. And the last thing we wanted to chat about, maybe Erin, you could pull it up, is so with NFPT, the personal trainer certification company that we work for, we have a risk factor profile that we use that personal trainers, that is in your scope of practice to run through this. In fact, you should always run through this with a new client, because especially if someone hasn't seen a doctor in a while, you can pick out whether or not they need to. And so why don't we just kind of briefly overview that, and we'll see there are some similarities between that and this test.
Yeah, it's actually, and I know it's really small and you probably can't see the whole thing, but it is pretty comprehensive. And when it comes to screening and evaluating your clients, like depending on the organization that you're certified through or what form you use, they're going to be pretty similar in terms of what they're asking and what they're measuring. How they're scored might vary a little bit. So I just encourage you, check with your organization. I've not ever seen a certifying agency that's accredited that doesn't have it within their manual or access through like their membership only or certified membership only portal. So make sure that you check that, especially if you're a new trainer and maybe you haven't gone through this. But the risk profile, and that's all it is a profile. This is not exact science. It's just something that trainers can use to help us identify, okay, does this person, are they a low risk? Are they moderate risk? Are they high risk? And if they are moderate to high, what maybe do I need to do there in terms of physician clearance, or do they need to get a stress test? What is it that they need to do? So this form, gender and age are going to be common on all forms, because there's a gender and age component linked to heart disease. And if a woman is over a certain age and a man is over a certain age, that automatically they get a number one. Unfortunately, it sucks. I know, but it's true. Then there's going to be heredity, like with your parents and siblings. Like if you had a personal history or a personal or family history of heart disease, that's one thing that we would check off, because we know that there's a historical link through genetics. So if a first degree relative had died of a heart attack or had X, Y, and Z, not saying that you're guaranteed to get it, but that's something we need to know and keep in mind, because as we know, genetics affects everything. History of diabetes, gout. If your client is having any kind of present cardiovascular disease symptoms, send them on their way. Symptoms, get them out of your gym, get them out and have them go to their doctor. That's just not something you want to mess around with. Of course, behavioral things like smoking, weight's always going to be something that is checked. What their current exercise, diet, blood pressure, resting heart rate is going to look like, and amount of stress that they're just generally under. So it's sort of an inventory of various categories of information. And for the NFPT, if they score over a certain number and that number is 32, then you need to I can't work with you until these things are in place. Physician clearance, and then the physician's going to decide, okay, if they're a high risk, then they probably need to have some sort of submaximal test or stress test with a physician present to be able to see how their body responds. So it's a great tool to use so you don't place yourself or your client in a frightening situation that one of you may not survive. You know, always, I'm more on the conservative end, because again, as trainers, we can't, open the window and see what's truly going on the inside. All we have to work with are these screening tools. And then if they present with no symptoms and they're low risk, absolutely test them. Absolutely get them going. But that's all we really have. We don't have solid exact numbers or a physician clearance. So if you're in doubt, get that clearance.
Yeah, totally. And if you have a client who is trying to make changes and they're not happening, like perhaps they're doing everything right and it's not happening, you could, and they don't want to take medication, because medication almost always does the trick, but medication has its downsides as well. So this is another alternative way that someone could go, is to dig a little deeper, figure out what might be going on with them. And then the kind of what I want to end on, you touched on at the very end of that list, is the stress factor. Oh. At the end of the day, if all this is going to stress you out, it's great to live forever. It's great to live till you're 100. But if you're so stressed all the time about your heart and your heart health, and you're not enjoying your life, then why live 100 years? So I feel like, there's a lot of emphasis put on like living forever and living long and seeing your children grow up. But if you're so stressed out, and the way you're trying to eat and everything and all these tests, and I personally don't think it's worth it, to be so concerned. Like, of course, I'm not saying don't worry about your heart health, but I'm just saying, like, maybe don't get too obsessed with it, because that's health nuts. We know all about that obsession, and we're actually going to talk about it in 2 weeks on the show.
Yes. And yeah, I think that's a great point. It's kind of like with clients that I've worked with in the past or students. Do I need to weigh myself every day? Oh, for the love of God, don't. And especially for females, like that weight, you'll be this weight one day and up a half a pound the next and down 3 pounds. I mean, if it's going to cause anxiety and stress, you're only exacerbating an already existing condition. Don't do it.
Yeah.
Let's figure out a different way to measure in a non-scale way. So yeah, it's the same type of thing. Like, again, taking an individualized approach. Don't get too obsessed, because that can then in turn have its own negative side effects for sure.
As we said, the stress will cause the release of sugar, and then
inflammation.
You're negatively affecting your heart. So, and I mean, if you do have some serious heart concerns or health concerns, it's important to address them, and then maybe compare yourself with a mental health professional or someone that can help you work through some of that anxiety, because I feel like And then we always go back to the sleep thing, you know, make sure you get enough sleep, because if you're not getting enough sleep, it's hard to manage your stress. And so, yeah. So
it's complex.
Yeah, totally. Awesome. Well, Billy says he's thinking about number 1, the lipids. So yeah, just kind of curious which of those 4 stood out to you guys. And unless you have other questions or thoughts, hopefully this was helpful for you today. If it was helpful, say yes, it was helpful. And if you found this episode helpful, share it, please. You know, in the name of the month of heart health. And so next week we're going to talk about, are you too friendly with your clients?
Mm-hmm. So, maybe a nice juicy topic. a
very personal career. So yeah, we're going to talk about that next week. And the week after that, we're going to dive into obsession and passion. So we're really just kind of circling around this theme this month. Why not?
Yeah, make it fun.
Awesome. Well, thanks for joining us, everybody. We're here every Wednesday at 10 a.m. Mountain Time and noon on the East Coast and 9 a.m. on the West Coast. And Myra says, yes, it was helpful. And Billy says, thinking about having it done. Awesome, good. Billy. Check back in with us. Would love to hear. About it, and we can compare some numbers. No. Right. It'd be fun. My husband did the test, so it's kind of fun if you get some people doing it. So yeah, we'll see you all next week. You can subscribe to the show on the NFPT Facebook page, and we'll see you next week and find out if you're too friendly with your clients.
That's right.
Bye, everyone.
Bye, guys.